Hello everyone and welcome to this episode of Trust TV. My name is Memo. I'm your host here, and with us we have Dr. Wilson. Dr. Wilson, thanks for being here.
Thanks, Memo. Thanks for having me.
We get a lot of inquiries and a lot of questions from different scenarios from viewers from all over the world. And in today's video, we're actually going to be covering one of them. And Dr. Wilson, to give you a little bit of a background, here we have an x-ray of a viewer who sent in this x-ray, but also some notes. His background, or the notes that he gave us, was saying that he's been to different doctors. As you can see, there's work that's been done here before. So we want to show our viewers like an online consultation. So if you can go ahead and...
Yeah, so this patient, he had sent me the images. So he's been to quite a few different doctors. And as you can see, he's actually had implants done already. And at one point he had 8 implants on the lower, and you can see, and for somebody who's not used to looking at x-rays, so as the image becomes lighter, that's more dense. So this is really dense bone, and then as it traverses up, it becomes less dense. And then where it's like black, that's air. So just to kind of orient ourselves around the x-ray. And you see these posts here. So right now he's got 3 implants left on the lower, and then he's got 7 implants left on the upper. At one point he said he had 8 implants on the lower. So he's lost 5 of the 8 on the lower. These 3 that are remaining are going to have to be removed, and then 4 on the upper have to be removed. So my point with this image or this patient or this scenario, because like Memo said, we do get a lot of patients inquiring whether they've had implants done, whether they've had work done outside or at other offices, or they need the work done. Our goal here today is to help patients avoid this sort of scenario because it's completely avoidable. This was done less than a year ago. So to have so many failures, implant failures or implants falling out in such a short period of time is definitely not the patient's fault. It's certainly a matter of the materials that were used, the type of implants that were used, the surgical technique that was used. Was it a sterile environment? What type of implant was used? I mean, when I look at this x-ray, I have so many questions, but at the end of the day, none of the questions that I have really make any difference because it is what it is. We cannot change the fact that the patient is going to lose all of these implants. So, because the other part of this is because the patient had asked me, can we use anything here? Is there has my money been lost completely, or can I use some of it? And my answer to that is I don't really think that the patient is able to utilize any of these implants because I don't want to build his case on a foundation that is not sound. You know, if I've lost over half of the implants that were placed, why would I trust, let's say 4 implants or less are left in the mouth, right? I mean, we were able to save 4 of them. I don't really trust those 4 implants to build this, case that needs to last him the rest of his life on the remaining 4 implants. So my philosophy is just take everything out. If we've had this many failures already, is just take it out, graft it, regenerate the bone, place a proper quality brand and proper technique, surgical technique of implant, and then build the case from there. So, again, this is not uncommon. We see these cases all the time. Patients sending in x-rays or having questions about, I've been to such and such implant center, I've had an all-on-4, it's failing, or the prosthetics are failing, what do I do now? And the unfortunate thing is they've already they've spent a lot of money. I mean, this patient's probably got $40,000 in his mouth as it is, and he has nothing to show for it because all of these implants are going to have to come out.
Question, because like you said, we get a lot of questions about situations like this. Like you're saying, this person went into, a dental implant center, they paid, quite a bit of money. Why do these cases fail?
That's a great question. This case certainly failed. One, a lot of it is, I think, surgical error. Implant surgery is a very delicate procedure, and you have to understand the physiology, the biomechanics, the elasticity of the bone. And so a couple of things. I mean, it's multifactorial, and in reality, I don't really know. But one, I think it's surgical error because as I noticed the bone pulling away from these implants, he probably over-torqued them. He put too much torque on the implant at the time of placement. And if you do that, a lot of times the bone will retract because it's like you put that screw in and the bone is just like really tight and the bone dies off. And so, and I'm seeing that everywhere. So to me, it was definitely surgical error, but it could also be the quality of the implants because I don't even know what system this is. By the way, I've not met this patient. I've never seen him. I've only talked to him on the phone, and I've only seen this x-ray. So I don't have a lot of history, but what I do have is that he's tried, like he's gone out, he's gone and tried to get, the work done. He knows what he needs, but unfortunately he ended up in the wrong office. And as a result, he's going to pay big time because where do I go from here? Once I pull these implants out, now I'm left with a lot less bone. I have to regenerate that bone. I've got to graft. Man, it just creates a scenario where I'm kind of, I'm starting, he was here, I'm starting from down here and have to get way up here, so, this would have been so avoidable had he just, and I'm not saying I'm the only guy that can do this, like chosen a practice, a doctor, a surgeon who really understands the dynamics, the biomechanics, the surgical aspect, the prosthetic aspect of implant surgery and prosthodontics. So, but right now, I mean, there's a lot of, these dream centers that are promising you the world that, but in the end, a lot of times the patients end up like this. There is no magic, quick, fast, guaranteed teeth in a day. This is going to last you the rest of your life. It's a process, and if you go through the process, the proper channels, selecting the proper doctor, choosing the doctor, choosing good quality materials, it is a transformative procedure. But on the contrary, when that doesn't happen, you end up with situations like this.
Yeah. Okay. Another thing is, we've mentioned this quite a bit, as we get a lot of these viewers sending in their x-rays and saying, hey, my implants, my prosthesis failed. I've been to 6 doctors and no one can fix it. But what we're trying to tell people is that this can be fixed, right? There's a solution for everyone's problems if you already have gotten implants, correct?
Yeah, for sure. I mean, I have no doubt I can fix this case. The problem is I have to start over, and it's going to be a longer process. It'll take me a good year plus to finish his case because I have to graft, let that heal for months, and then go back in, place the implants. So, it just adds time, but in the end, if we can give him a fixed permanent set of teeth, that's what he wants. That's what he wanted in the beginning, And so, there's nothing, there's no magic. There's, no dream center that can take you in one day and then give you teeth the next day with 0 complications. That's just not possible. Here at Trust Implants, we look at each case individually. We don't do all on 4s. We do what is most appropriate for the patient, give them the appropriate number of implants, grafting in the appropriate areas so that we have ideal distribution of implants. We have ideal mechanics so that things function properly. And, the more and more I see these cases and I see these scenarios, the more passionate I am about my message, because I'm just seeing this so much now from patients from outside and, that end up in our office after having spent a lot of time, effort, energy, and money.
Yeah, yeah, and yeah, that's the whole goal of this channel, right? We're just trying to educate people, trying to show you why, or what the best thing is for them, what the best thing they can do. Like you said, you don't have to. Not everyone has to come here, but do your research. You know, find the right practitioner.
Yeah. I can't do them all. I can't.
Exactly.
I can't do everybody's case. So just do your homework. Find somebody who's qualified. Find someone who's trained. You know, a board certified oral maxillofacial surgeon, possibly for your implants. A prosthodontist for the restorative work. But nowadays we're seeing implant centers pop up on every corner, and in the ADA there is no. It's kind of like the wild west, and I've said this 1,000 times. There's no regulatory body for implant dentistry. And so any dentist can pop up a implant center and say, yeah, I'm the implant guy. You know, I have bona fide training. I won't belabor that, but I've been practicing this for 22 years. But it's important because it's such a great transformative procedure. It is an investment. It does cost money, but at the same time, it's life-changing. But it can be catastrophic when it doesn't work for the patient. You know.
Yeah, of course. Well, thank you, Dr. Willardsen. Thank you for doing this online consultation, and thanks for watching. Feel free to send in your own x-ray if you'd like Dr. Willardsen to do an online consultation. And if you like these videos and like our channel, be sure to hit that like button, subscribe, and leave a comment if you have any questions. Again, thanks for watching Trust TV.